Okay, the first thing that I want to talk about today is communication with me. So one of the things that I like to point out is that when you start your schooling career, I want you to look at that as your career. So whenever you give me communication through text messages, and I'm not saying this is any of you, this is just general information, okay? Whenever you send me a text message, I want you guys to be, you don't have to be uptight and stuffy, but I don't want slang. I don't want curse words. You understand what I mean? Let's not, I want everybody to get into the habit of putting on that professional face now, because when you begin to work in a medical facility, the very first thing that they're going to notice is first impressions, right? You only get one chance to make a first impression. They're going to look at how you speak. They're going to look at how you dress, and they're going to look at your attitude. I don't know if I've told you guys this before, but say you have two coders in a room. One's older and surly, and she's got a nasty attitude. She's just got that face on. And then you have, say, a younger coder who's just gotten out of school. She's got a good attitude. She's excited, she's eager, and she's upbeat. Who are they going to hire? They want that employee with a good attitude, right? Because they can teach that employee. You can get the experience, but sometimes you cannot teach the bad attitude out of somebody. So that enthusiasm, do y'all think I'm bubbly and enthusiastic? I'm like this all the time, even if I don't feel like it, because this is the way I feel like I can, my enthusiasm kind of passes off to you, right? Hi, Melissa, glad to see you.
Hi.
Okay, well, what's the first thing we're going to do today? What is the first step every time we have class? Medical terminology. Okay, Sean, if you don't have a pen and pencil, now remember, I'm going to upload this under daily assignment. So if you can't keep up with, as we're doing the medical terms and writing them down, you can go back and view this again, okay? But I'll try to do it a little slower. So every time we do Zoom class, the first thing that we do is we do medical terminology. So let me share my screen. I did not do a new one because we did 2 new ones on Tuesday. Let me X out of this. Let's see. That's not that one. Sorry. Gotta find it. This thing just gets in my way. Just a minute. I'm getting there. Okay, so remember, you guys have to turn your unmute yourselves so you can answer, okay? So the medical term itis means
Inflammation.
Inflammation. Gaster or gastro?
Stomach.
Stomach. Raphy?
Suture.
Suture, yeah.
Suture.
Ectomy?
Surgical removal.
Surgical removal. Nephro?
Kidney.
Kidney.
Kidney. Plasty?
Surgical repair.
Surgical repair.
Surgical repair. Go.
Visual exam.
Yeah.
Algia?
Pain.
Pain.
Sorry, guys. Synthesis.
Puncture cavity to remove fluid.
Puncture a cavity to remove fluid. I always think of amniocentesis, and that's whenever you're pregnant and they take that needle, put it in, and suck some of the fluid out to have it tested. Endo.
Within, inner.
Within and inner. I went pretty fast, Sean. I know. Do you want me to go back through real quick? I can't hear you.
I've got most of it.
Okay. So you just want to go back and review it after we're done? Or you want me to, oh, that's fine?
Because I only missed 2.
Oh, okay. Well, which 2 did you miss? Let's go back.
First 2.
The first 2 you said?
Yes, ma'am.
Okay, let's go back. So number 1 is itis. That means inflammation. Gaster or gastro. That means stomach.
Okay.
So we can only do 20, so I have to start a new round of them next week. So what I'm going to do is, I don't know, I want us to get up to maybe 40 or 50 before we take a quiz on it. So I'll probably just try to do our new ones, just keep adding, and I'll just switch the Jamboards. That's the only thing about Jamboards is they only allow you to have 20 sheets of paper before they make you do a new one. So do you guys remember the other day when we talked about intubation? Do you remember what that means? To be,
Put the tube.
yeah. So I'm going to do just a little video on intubation just because I find it very interesting. And it also gives us a really, really good view of the anatomy of the respiratory system.
Endotracheal intubation and mechanical ventilation if you are in an emergency situation involving severe respiratory problems, or if you are having general anesthesia during a surgical procedure. When you breathe, air moves into your lungs when a muscle called the diaphragm, along with other muscles nearby, contracts and causes the chest cavity to expand. Air is exhaled when these muscles relax, and the lung tissue passively returns to its original size. This is called respiration. During respiration, oxygen in the air passes through your nose or mouth and into your pharynx or throat. It then goes into your trachea or windpipe. Your trachea divides to become the left and right main bronchi, which enter your lungs. Inside your lungs, the main bronchi divide repeatedly and eventually become small tubes called bronchioles. At the end of the bronchioles are tiny air sacs called alveoli. Oxygen in your alveoli is absorbed into nearby blood vessels called capillaries. At the same time, carbon dioxide, a gas in your blood that must be removed, passes into the alveoli and back out through the airways. This process is called gas exchange. If you have severe respiratory problems, the oxygen levels in your blood may drop too low, or the carbon dioxide levels may rise too high. Either of these conditions can result in damage to your vital organs, including your heart and brain. Some conditions that may lead to severe respiratory problems include drowning, an obstruction in the trachea such as a foreign object or tumor, obstructive pulmonary diseases such as asthma, chronic bronchitis, and emphysema, diseases such as pneumonia and acute respiratory distress syndrome, or ARDS, severe weakness of the muscles that control breathing, and damage to the bones and tissues of the chest. Under these circumstances, you may need additional oxygen or breathing support through mechanical ventilation. Mechanical ventilation is also used during surgical procedures, for delivering anesthetic drugs, preventing the aspiration of stomach contents into the lungs, and closely controlling the levels of oxygen and carbon dioxide in the blood during surgery. Before you are intubated and ventilated for a surgical procedure, an intravenous line or IV will be started, and your doctor will give you medication through your IV to put you to sleep. As the medication takes effect, he or she will place an oxygen mask over your nose and mouth and ask you to breathe deeply, ensuring that you will have a reserve of oxygen in your system prior to the procedure. The first step in mechanical ventilation is called endotracheal intubation. Once you are asleep, your doctor will use an instrument called a laryngoscope to perform the intubation. A laryngoscope, which consists of a handle, light, and dull blade, helps guide the endotracheal tube to its proper position. Your doctor will tilt your head back slightly and insert the laryngoscope through your mouth and down into your throat, taking special care to avoid contact with your teeth. Using the blade, your doctor will gently raise the epiglottis, which is a flap of tissue protecting your larynx. He or she will then advance the tip of the endotracheal tube into the trachea. Once the endotracheal tube is in the trachea, your doctor will inflate a small balloon surrounding the tube to make sure it remains snugly in place. Your doctor will remove the laryngoscope and tape the tube to the corner of your mouth to prevent it from being jostled out of position. Your doctor will check to see that the tube is properly positioned in the lower part of the trachea by inflating your lungs with a special bag and listening for breath sounds on both sides of your chest. If the end of the tube is too low, both lungs will not receive the same amount of air. In some cases, an X-ray is taken immediately after intubation to confirm the tube's placement. Once the endotracheal tube is in the proper position, your doctor will attach it to the mechanical ventilator, a specially designed pump that aids respiration by delivering well-oxygenated air into the lungs and permitting carbon dioxide to escape from the lungs. Levels of oxygen and carbon dioxide will be closely monitored to confirm that the ventilator is working. Once your surgical procedure is complete, your doctor will not remove the endotracheal tube until you are able to safely breathe on your own. He or she will make this determination by measuring how often you take a breath and how much air you breathe in and out with each breath.
Wasn't that interesting? I watched
Yeah.
that yesterday. I thought that that was such an, when you get on YouTube and you start researching things to show, I really do watch them before, because if they catch my attention, or if they're, you know what I mean, I want to pick the best one. There's so many to choose from, but I just love the graphics in that. To me, it was just so clear what they were doing. So
Makes me want to breathe.
yeah, okay, make sure I'm breathing in good. But also with what we, our little video that we watched on Tuesday, we got to see some of those terms again, right? Did you start thinking, oh, we talked about that Tuesday? Oh yeah, we saw that Tuesday. So it makes you more familiar with what we're doing. Okay, so who's ready to code? Let's go ahead and get out our CPT manuals. Sean, do you have yours?
Yes, I have mine.
Okay, good deal. All right. Well, Sean, because this is your first class with us, I'm just going to kind of show you. I don't know how good this is going to be, but do you see all of my little tabs here?
Yes.
I like to tab each one of my sections. Guys, I am going to pull this camera off. Y'all don't get seasick. I'm going to show him my respiratory section, okay? Just so he knows that he can do this way if he wants to. Well, let me open up my CPT. Okay, I'm going to grab my camera. Please bear with me. I know this is not exactly the best way to do this. But so Sean, you see here that this is my respiratory tab that I got out of the front of my book. Did you see this little paper in the front of your CPT manual?
Yes.
Okay, what we're doing is we're taking these off and putting them in the proper place in our CPT. So the respiratory RESP, the little green tab, would go right here. And then I further label mine. I just buy labels from Walmart. So I did my nose section. And I'm just looking, see, nose is in red. And then here we have sinuses in red. And then I put sinuses here.
Okay.
So I'm just kind of breaking it down in each chapter even further for myself. So if I don't want to go to the index to look up a code, which are indexes in the back of our book here, I don't want to go to the index to look up a code, and I know that it's under nose, I can just look at under nose, right? But most things we still look under the index, right, guys? Most things we still go to the index. Okay, so I'm going to go ahead and I would like for some of you, if you don't have a lot of background noise, kind of talk about the coding part of it, what oh, what am I trying to say? How do you code? What do we do first? Where do we go? So that Sean is able to kind of see, I hear thought processes on how we actually code. So let's have a coding discussion without it being overwhelming, okay? All right, so now we got to wait for this thing to move again. Here we go. Okay, so this is our first coding scenario. Bilateral nasal endoscopy with total ethmoidectomy. So what key term do you guys think that we need to look up in the index? Okay, well, let's stop and think.
Endoscopy.
We can endoscopy, but also we can also look under anatomic site, because how is the respiratory system, how's it broken down in the CPT? By anatomic site. So endoscopy is not a bad choice. Let me ask you a question. If you choose the wrong word to look up, what do you do?
Find another one.
Up another word.
We don't always choose the right main term the first time around, do we?
Not at all.
So bilateral nasal endoscopy with total ethmoidectomy. So somebody said endoscopy. Who wants to look up nasal? Look up nasal, and then somebody look up ethmoidectomy, and then let's talk about where that brings us. I'm going to go to ethmoidectomy just because I want to. I like saying the word.
I found it.
You found ethmoidectomy?
Mhm.
Okay. Just
And it
hold
says in-
there.
Okay.
Just hold one moment. Who's looking up nasal? Well, y'all, I can't see you. I don't know who me is.
Anthony, I'm looking.
Aaron is.
Aaron and Antoinette, do you see nasal? And then who's got endoscopy?
I have endoscopy.
Okay. So Miss Rhonda, what do you see under endoscopy? Do you see?
Okay, it's gonna be about that. So, because I'm looking under the wrong thing, I believe. I'm looking under nasal sinuses. Instead.
Okay, well, that's fine. You can stay there. I'm looking at endoscopy on page 1031, and I'm just kind of looking. It's nasal, right? So we have to look under the nasal. So I'm just kind of see if we can get there with endoscopy. Okay, I see nose. And then it says diagnostic, surgical, and it has just a bunch of stuff. When we look under ethmoidectomy on page 1036, it says anterior, endoscopic, partial, skull-based surgery, and total. Aaron, what do you see when you look under nose or nasal?
So when I went to the index, I went under, I went under N, and then under nasal sinuses, if you go down, they do have endoscopy, but if you go farther, they have like ethmoid, and then underneath that, they have ethmoidectomy, and they give you 2 CPT codes to look at.
Okay. All right, and I would like to say that I went to ethmoidectomy, and if you go down and you do endoscopic, it gives you the same exact 2 CPT codes, whether you go to endoscopy or nasal sinus. So is there just one right way to get there?
No.
No. You could, there's a lot of these things, or there's not just one perfect way to get there. So if we go ethmoidectomy, our choice is 31254, or 31255. So let's go back to the tabular where our numbers are, back in our respiratory section. And let's look at those and let's make a decision. Don't blurt the decision out yet though, okay?
Okay.
Okay, what we need to remember is that it's a total ethmoidectomy.
Mhm. Which bilateral means both sides?
Both sides, yes.
Okay.
But
Okay,
you
but I have a, oh, I'm sorry, go ahead.
if it's a total, it can't be a unilateral. It has to be both. So what's your question, Erin?
I know that it is bilateral, but anterior and posterior doesn't mean bilateral, correct?
I'd have to look at that. Because
To me, that's more of like a front and behind versus a left and a right. So
yeah, I wouldn't think because I wouldn't think so. That's a good question. I'm not
so does
sure.
that mean that, oh wait,
Okay.
so does that mean that it would have to have a modifier on it?
I would put a modifier on it, yes.
Okay.
So if you some of you guys haven't done modifiers, don't worry about that. When we do testing and there's supposed to be a modifier on it, if you don't put a modifier there, I don't mark it wrong. I just, because the way that they separate things. Okay, so we have a choice. It can be 31254 or 31255. So Sean, do you think you have an answer? I can't hear you.
I have no clue.
Okay, so can you in your CPT manual, can you turn to page 272? I mean, sorry, 217.
17.
Okay, Miss Rhonda, I corrected my.
All righty.
Okay. Look at code 31254 and 31255. And I'm going to turn the screen back around so we can look at it. So when we looked up in the index, we looked under ethmoidectomy. And we went to endoscopy, and then it gave us 31254 or 31255. Now, the word total is what you have to look for here. And so if you look at 31255, it's a total, right?
Yes.
So our answer would be 31255. Okay, on the next one, I'm going to go a little slower step by step so that you can get used to the steps. What we're going to do, Sean, is we're going to pick a key term. And just like you would look in the back of the book for a definition, we're going to choose a key term. We're going to look it up in the back of our book in our index. Then we're going to look at our numbers that it says beside it. Then we go back to this called the tabular and we double check it. And I know that sounds like a lot, but we're going to do it slowly, okay? So that way you kind of get a feel for it. And once you get a feel for it, it's not any big deal, is it, guys?
Not at all.
No.
Not at all. I know it's like, oh my goodness, what is she doing? But I promise it's not going to feel like that always. All right, so here we go. Oh, 31255, we're right. Okay, direct laryngoscopy with stripping of vocal cords. Okay, Sean, when we're looking at this, think of the verb. What did we actually do? What is our action that we're doing? We're doing a laryngoscopy, right?
Yes.
With stripping of vocal cords, that's kind of just and direct. Those things are important, but when we're choosing a key term to look up in the index, it's exactly what are we doing. So let's look in the back of the book for laryngoscopy. So I'm going to go all the way back to the back of the book into my L's. Y'all let me know when you get to laryngoscopy in the index, and let's pause. Are you there?
I am.
Sean, are you there?
Yes, ma'am.
Okay, all right. So let's go to the next thing we need to look at. So when we look right underneath laryngoscopy, do you see that word direct?
Yes.
And then here we have direct, right? Okay, so that's matching up pretty good. So with stripping of vocal cords,
Says 31540 and 31541.
okay, where do you see that?
If you keep going down, it tells you at the bottom, stripping of vocal cords.
Oh, I see it now because, and it's operative, right? So,
Yes.
Sean, do you see stripping of vocal cords as you read down at the very bottom? All right,
Yes.
so what we're going to do is we're going to take that 31540 and 31541, and we're going to go back to the tabular where our numbers are, and we're going to look up those two codes, and we're going to make a decision. I'm going to tell you, I always keep a little piece of paper next to me, Sean, or a little notebook, so I can write those numbers down because I'm older and I can't remember those numbers, but you might be able to. You're young.
Me either.
I have a question, but I have a question. This is Erin. Before we flip, it might be too late, but in the index, I do see the stripping of vocal cords, but that's not under direct anymore. It's under flexible. So,
Okay, I'm trying to get back there.
sorry.
No, you're good. It's actually a great question because I noticed the same thing too. I was kind of stuck with that, but okay.
1090 is the page it's on.
Thank you, because I'm apparently having trouble with my alphabet right now. Well, you're right. It's under flexible, but if you look, I don't know, it's a bit confusing when they do things this way. If you look under direct, it says aspiration, biopsy, diagnostic, dilation, exploration, and
Yes, it's not really anything that it's
there's not
describing.
anything there that kind of matches up.
Okay.
So, stripping of vocal cords is more of an operative procedure, and not because I know that, but just because I can imagine if you're stripping vocal cords, it's going to be a type of operation.
Right.
So that's kind of where I thought that we were going, but I don't understand why that's under flexible.
That was something I had noticed and I wanted to ask about it because of the fact that I know in the PowerPoint slide, it said direct. So
Yeah, but
Okay.
if you stay under direct, this is what I'm going to tell you. If you're under laryngoscopy and you stay under direct and you have 31515 through 31571,
mhm.
you're going to find your CPT code for the stripping within those codes, within that big
Okay.
range. But because you just happen to see stripping of vocal cords, it narrowed it down for you. So you're not wrong by going under direct. You're just going to have to look a little harder.
Okay.
I didn't even notice, Melissa, you're the one who's noticed the stripping of vocal cords. I was
Yeah.
ready to go through all of those things because to me, we were under direct and I can be very black and white and tunnel vision sometimes. So I was willing to read through all of that, but we're going to be able to go. All right. So 31540 and 41.
I'm at a meeting at work, so if I look like I'm listening, I ain't listening to them because they talk about the same thing. So, but I gotta read myself because they're on my phone in a meeting.
It's okay. Miss Rhonda, what do you think? Is it 31540 or 31541?
I don't even remember what all was in the question, so.
Where's the sheet at where it tells you the
Yeah.
description?
I'm going back to it.
Okay.
Direct laryngoscopy with stripping of vocal cords.
No, it doesn't really say it's with a microscope. So I guess it would be 31540.
Four, that's what I see. 31540.
Okay, who agrees with 31540?
It could be.
Sonia, do you agree? Sonia,
Yes, I'm sorry.
do you agree? Okay,
I
I'm absolutely sure that that's the answer you want to give.
No, I am. I started tabbing at the top.
Yeah, Sean, you can ask the ladies. Sometimes I'm like, do you agree? Or are you sure that's what you want to give? Because I want you to be confident in your answer. Even if it's wrong, I want you to have confidence in it. Y'all are right. 31540. So Sean, did that one feel a little bit better to you than the first one?
Yes.
Good deal. All right. So here we go back to our little sheet. Let's see. 31540. Okay.
We know where we're going with that.
Bronchoalveolar, bronchoalveolar, alveolar. All right, lavage. I'm not going to try to say it anymore. Okay, so what do you think that we should look up? What word?
And first word.
Long one.
Yeah.
Alveolar.
Bronchialveolar. Y'all have to just admit I'm brave for trying, okay?
Mhm. You have to go to with Google and put it in and then press the little button where it talks and tells you how to pronounce it.
Okay.
That's what I would do.
That's how we do at work. We have to use Google Speak to translate, Google Translate to translate from English to Spanish. And it really works.
All right, well, I want y'all to keep in mind the alveoli. Where's that? It's in the lung, right? We just saw those, the little things that look like grapes.
Right.
Okay, I just wanted to point that out.
That's exactly where to say to go see.
It tells me, what's that? See lung. Okay, so I'll go to lung.
Well, do you want to go to lung or do you want to go to lavage?
Lavage.
Let's go to lavage. Okay. Well, I'm looking at lavage.
Okay, and remember where the
It says bronchial 31624.
That's the closest we're gonna get.
hang on,
And
31624.
says with bronchial alveolar lavage. So when it says with, does that mean it's a endoscopy procedure or bronchoscopy? Is that, oh, okay, So.
So I know it's not an add-on code because there is no plus sign in front of the number.
Yeah.
But when it says with, it makes me think that it should be because of that word.
It makes me think that too. That's why I keep looking back and
Yeah.
forth sometimes.
All right. So So I'm not sure if I've made this point before, but I'm gonna tell you guys now because it's just giving you those few words behind, right? Look at 31622 on page 221. It says bronchoscopy, rigid or flexible, including fluoroscopic guidance when performed. And do you see that semicolon right there?
Yes.
Okay, that is your main code, 31622. That semicolon, after that semicolon on 31622, if you look at 31623 with bruising and or protected brushing, that takes the place of 31622. After that semicolon, I know I'm not saying this right. Erin, help me say it the way it's understandable.
Are you talking about semicolon?
The semicolon. So the semicolon in 31622, it says bronchoscopy and all of that. Then you have your semicolon and it gives more words.
So basically everything after the semicolon is what the codes afterward are
Or the
replacing.
codes afterwards. It takes the place of those words.
Right.
See, I can't say it where it makes sense.
I have that problem all the time. So I'm like super shocked that you're asking me to help you, but I'm glad I could help.
You don't understand what I'm saying. Antoinette, can you put it in a different way to where it will make sense, or you? Everything after the semicolon, after you go under that main code, changes. The main part is bronchoscopy, rigid or flexible, including fluoroscopic guidance when performed, diagnostic, blah, 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 blah. Then if they don't want to type that on every single code that it goes with. So
Okay.
after the semicolon is what's going to change. As the numbers change, that main portion stays the same, but after the semicolon changes, like 31622 may say partial and 31623 may say total, but it may still be the same procedure, but it's telling you the difference. Why can't I say that right?
I think you hit the head on the hammer with that one. You explained it right this time.
I think we got it. All right. So what is our code going to be for our lavage?
Three, 1, 6, 4.
Does everybody agree?
Yes.
Yes, ma'am, Miss Rhonda. Oh, that meant you agreed? Okay. All right. All right. Let's move on to our next one. Okay, this one. Oh, well, no, I was going to let y'all do this one on your own, but let's do it together because just because there's a lot of words does not mean it's scary, right? Flexible fiber optic laryngoscopy performed for removal of a dime lodged in a patient's larynx. So what did we actually do?
For removing an obstruction in the lungs, right?
Well, it was lodged in the patient's larynx. What did we did a laryngoscopy, right? Flexible fiber optic was part, it's describing the type of laryngoscopy, but actually what we did was a laryngoscopy. So where do we have to go?
In the index, you can go under laryngoscopy.
Right.
And then they have flexible underneath that.
Okay, well, let's let everybody get to laryngoscopy.
Okay.
And then we can talk more about it.
Says removal of foreign body.
Laryngoscopy, removal. This one may just be the easiest one we've done so far.
Yeah.
So laryngoscopy, flexible.
And then it has a semicolon, and then you go down and it says removal at 31577.
Okay, so removal of foreign body.
So if they do like,
Did everybody see that in the index?
Yes.
Okay, so let's check 31577 in our tabular and see if we have the right.
At the top, you'll see 31575 and it describes it. And then it has that semicolon.
case like they actually have,
Even though I didn't say it great, it still made sense and y'all see the difference.
well, I would still go ahead and continue to go through the symptom list, just to make sure.
Antoinette, mute me.
Oh, I'm sorry.
We get to be a part of Antoinette's meeting. Okay.
Other questions or concerns, emotional outbursts, we have
I'm trying to read it.
15 minutes, so we have plenty of time.
There we go. Okay, so 31577 with removal of a foreign body. Do we agree that that's what our scenario is?
Yes.
That's absolutely right. So I want to point out again, and I'm looking at you while I'm telling you this, just because there's a lot of words, does that mean it's scary? Because that was the easiest one we've done thus far, correct? So do not get intimidated if there's lots of words. Let's just pick out the words we need. All right, so here we go.
I have a quick question. If we have time.
Sure.
So I guess because I didn't come in at the beginning of where I came in, I was at the end of a course.
Mhm.
But how do I know, or how do you know as a coder when you need to code more than one part versus just
When
like
you
if there's
to code,
go ahead, sorry. Right.
you'll be able to clearly see that, for example, if I were coding a heart catheterization and they did an EKG before, it's going to be sectioned off for you. You're going to actually be able to see more than one procedure.
Okay.
So, and we're actually going to get into coding that's a little bit harder like that, but it takes a little bit of time.
Okay.
And I can actually put some of those in next week so we can see them. Y'all just help me remember, okay? Okay, flexible bronchoscopy with cell washing, brushing, and biopsy. So what main term are we looking up?
Bronchoscopy.
That's it,
Bronchoscopy.
bronchoscopy. Okay, so y'all don't say anything. I'm gonna wait for everybody and then I'm gonna have you give me the code when I say give me the code, okay? I want y'all to do this one on your own. Did y'all hear the Jeopardy music I was playing for you? I thought y'all would get a kick out of that. I'm not singing it today. How we doing, Miss Rhonda?
It's got me stumped.
Okay, so who has the answer?
I'm not sure about mine.
I
I
have
don't know
it.
if it's right or not, but
Okay, so Erin, can you take us from the beginning and map us through what you did to find the code?
so I went to my index
Mhm.
and I looked up bronchoscopy.
Okay.
And then under there, they had, under the listing, I picked brushing and protected brushing.
Okay.
And it gave me a CPT code. So then from there, I went back to my tabular in the respiratory section and I looked at that. So then I went back and I got 31623. And I looked, and the previous code has bronchoscopy, or however you say it, rigid or flexible. And it says diagnostic with cell washing. And then underneath it, which is 31623, and then it has with brushing and protected brushing. So that's why I picked 31623.
Hey, who's in agreement?
I agree.
What threw me off was it said biopsy too.
What about you, Sean? Did you get it?
I mean,
So that
I
threw me
got
off.
the same one Aaron said. But like Ms. Rhonda said, the biopsy is what threw me off as well.
And Sean and Rhonda, I was the same way because I was confused with the biopsy, but on the previous code where it says 31622, it does have diagnostic. So I feel like biopsy is included in the diagnostic part of that code.
Okay.
Right. So one of the things that can be most difficult is it's not always going to line up exactly every word. So sometimes if you think a little bit outside the box, okay, so what is a biopsy? Well, it's to diagnose something, right? They biopsy something, they send it to the lab to give you a diagnosis. So diagnostic and biopsy falls under diagnostic. But even if I know that that one word tripped you up, but you still would have gotten it because you would have been like, okay, that word must not be important in this scenario. I'm just going to go with the closest thing. And so your closest thing would have been 31623. You guys are rocking it out. I love it. Okay. All right. I put in some interesting ones. Cadaver donor pneumonectomy.
I know I've seen that word before. I just.
So when you get pneumonia, where do you get pneumonia at?
In your lungs.
In your lungs, right? So pick a word and let's look. I'm just gonna look up pneumonectomy just because I think that's a cool word, right?
Okay. They give you a donor. $32850 and then 33930.
Okay, well let's hold off just a minute so everybody can who looked up pneumonectomy? How many of us?
It's on page 1134.
So did anybody look up donor?
I'm looking it up now. Yes, ma'am. It's on page 231 in the tabular.
Okay, so there's actually two ways to get to this code. You can look up pneumonectomy and give me those code ranges again, Melissa.
It is 32850
Or
and then or 33930.
okay, And under donor, if we
It's
look
true.
at lung, it only gives a lung excision, it only gives us 32850. So still you can, either way, you would find the correct answer. So let's go to our tabular and let's decide which code it's going to be. Sonia, what do you think? What's our answer?
32850.
Do we agree or disagree?
I agree.
What you think, Sean? Thumbs up, thumb down. All right, let's see. 32850. Wasn't that interesting? I like to put some of the interesting ones in. I just thought the donor's probably not something we'd see very often, especially a cadaver donor. Okay, we're going to do one more, okay? Tracheostomy with division of thyroid isthmus. So what did we actually do here? We did a tracheotomy, right? Ostomy, a tracheostomy. So what's the word we're going to look up in our index?
Tracheostomy.
All right, I don't want anybody yelling out. Don't say anything. Let's let everybody work on their own for just a moment to make sure that we actually have the systems down here. And you're going to need to be very careful on your wording and how it's spelled here because there's lots of choices, okay? We're doing an ostomy, not an ectomy. Okay, and let's talk it out a little bit. So a tracheostomy with division of thyroid isthmus. This isn't say emergency, right? It's
So
not
would it be
revision
planned?
for a scar. It's going to be planned because they're doing what? They're dividing the thyroid isthmus. So it's planned. So that gives us two choices, right?
The two choices, the age. One's older, the other one's under 2 years. Is that what we're looking at?
I'm not.
This is
I looked under
31600.
Yeah, I look. I'm sorry, what?
I'm looking at incision 31600 and 31601. That's for planned. One's kids age under 2, and the other one says planned. You know, it's under the same, but
So Sean, what do you think? What do you think our code is?
I mean, because I looked up trachectomy, but I'm gonna go with 31600.
Everybody agree?
Yes.
That's right. Okay, do y'all feel good about where you are now?
Man,
Feeling more confident? The class helped?
it did.
What do you think, Sean? Do you feel like you have a better handle on it now?
Well, yes, because I was having
Good, yay. Good deal. All right, well, does anybody have any questions or do you need anything from me before we go? It was absolutely wonderful coding with you today. You guys know my favorite place to be is, well, with y'all on Zoom because I can't have you in the classroom. So if you need anything, please reach out, let me know. Have a wonderful day and a wonderful weekend. Do your schoolwork, guys.
Yes, ma'am.
Bye.
Bye. Bye.